Hi everyone, my name is Margot. I have a disability called cerebral palsy. Cerebral palsy is a brain injury that happens before, during, or shortly after birth. And the brain injury happens while the brain is still developing. This is why it's referred to as a developmental disability. It mostly affects the baby's physical movement because the part of the brain that's developing when the injury happens tends to be the motor area. What you'll see in cerebral palsy, it affects different parts of the brain, so it'll affect different parts of the body. Some people have cerebral palsy on one side of the body. That's called hemiplegia or hemiparesis cerebral palsy. It looks very similar to when an adult will have a stroke on one side, so the baby will curl one hand up or not be able to use a leg on one side very well. And then there's spastic diplegia, which is what I have, and that is where both legs are mainly affected and the arms are less affected, but the fine motor development will be affected. In athetoid cerebral palsy, you have muscles that are tight like you have in spastic cerebral palsy, but also some of the muscles are too loose, which is called hypotonia. And then you also have quadriplegia CP, which could happen with both spastic or athetoid CP, where all four limbs are affected. And as the baby is growing up, you'll notice that most of the milestones like walking, crawling, and anything related to movement will be delayed, with one exception. With the spastic diplegia CP and spastic quadriplegia, sometimes the baby will actually roll over a little bit before the normal time for this milestone will happen, because it's natural for babies with spastic cerebral palsy to arch their backs up. So it makes it easier for them to roll over. The other thing with cerebral palsy during development is we have something called the Moro reflex. All babies have the Moro reflex up until about 6 months of age. This is a reflex that makes you kind of jump. It's a type of startle reflex, and it sort of looks like all the limbs are reaching out to grab onto the baby's mother. And in the case of cerebral palsy, this Moro reflex never actually disappears. It stays with us until adulthood. So when we get startled by a sudden sound or a sudden movement, all four of our limbs will sort of jump out, and it will cause a lot of adrenaline to go into our body. The other thing that you will see with our development is as we get into school age, like elementary school age, we'll have a lot of fine motor difficulty with like drawing and different things having to do with numbers and position, because people with CP have a lack of proprioception. That's a sense of where your limbs are in space, and also tells your body how far away from other objects you are. So it can affect your spatial orientation and your ability to track movement. Some people with CP also have some problems with their hearing or their vision, so they may need to have that accommodated as well. In my case, I had to wear a patch as a baby, and I also have some visual issues, which is why I have glasses, but most of my visual issues have to do with spatial orientation and proprioception. Even though I can see objects, I can't tell how far away they are, and I have trouble tracking words, so I need larger print. People with CP tend to have, even as babies, less stamina